Welcome to Reflections, a program where we discuss values and virtues for the transformation of the individual and the society in general. I have with me in the studio our friend Professor Andrew Zamani. Prof, you're welcome.
Thank you, Father
With
George.
COVID, instead of stretching my hand, I do this. Great. Thank you for the work you are doing. I have watched you on TV. You have come to this studio. We have been discussing mental health and the COVID-19 and what it is likely to bring up in homes, in domestic settings, in social settings, and so on and so forth. Now, this segment, I would like us to discuss the issue of security, the security of nations. We are hearing of all kinds of conspiracy theories. And for me, there is no smoke without fire. Perhaps this COVID-19 coronavirus, perhaps it is developed in a factory. It's a biological weapon. What about the vaccines that have been developed? Are there security challenges with regards to the vaccines that have been developed? Are we safe? Is there a new threat of enslavement of Africans, colonization of Africans? Is there a threat of population control using the excuse of COVID-19 and vaccines? A lot of experiments have been done before with black people. A lot of experiments have been done. Not too many years ago, while President Bill Clinton actually had to apologize for the Tuskegee experiment, where experiment was done on syphilis with black people, and black people were injected with syphilis, and the scientists wanted to watch them how they will die with syphilis. Not too many years ago also, we had the water supply to a particular black community in the US poisoned with infertility agents to make sure that they were not multiplying. Now, and we know that a lot of agencies, including some reputable agencies, are engaged in fighting against the population of black people, population of Africans. So, now that everybody is talking about vaccines for COVID-19, are there security dimensions to it? Perhaps you have some views on this.
Thank you very much. COVID-19, it's really a big challenge. It is both a public health issue and a political and security issue.
Political and security issue.
Yes.
So everything that we're hearing and the help we may be getting may not just be charity.
The public health aspect is what is being dealt with now by the federal government. But the conspiracy theories that have emerged, which in a previous discussion I mentioned, have not really been addressed
and there is
in the public,
yeah,
which have capacity to affect the acceptance of the narratives by the citizens. Of the presidential task force and whatever state task forces that are in place.
If these conspiracy theories are there and they are not
because
addressed.
First, yes, they make the entire thing a myth. These conspiracy theories may be fraught with a lot of misinformation.
Okay.
But there may be elements of truth. Right now, you would notice that what COVID-19 has done to the world is what Hezbollah has done, what
ISIS
has done, what Boko Haram has done to the different geopolitical locations where they operate. The targeting of soft targets, the focus on soft targets to instill fear. Can you imagine that we have just about 182 as at today?
182 patients.
Yes, 182
positive.
Yes, confirmed cases, but 2 deaths.
Yes.
Since
months.
inception, let's say, since inception, 2 deaths, which means that we have the capacity actually to really respond.
Yes, that we are responding.
Exactly. The question, however, is what we report as positive cases, are they truly positive cases? Are we the ones producing the reagents? What are the sources of our reagents? Or what capacity do we have within the country to test?
To determine that indeed these people are positive, COVID-19 positive.
Yes. What is the local capacity for us to determine the adequacy or the
veracity,
the veracity of the
tests,
the chemical contents of the reagents that determine
positive or negative results.
Or negative cases. Now, I'm saying this with due respect to our leaders and to our scientists and so on and so forth. But you see, the political process can be such that messes up the intellectual. And most intellectuals are not politically minded.
And vice versa.
Let me give you an example, sir. Why has it been difficult for us to make a headway in electricity supply, power supply, over the years? Why have generators replaced the capacity of our power generating mechanism to assure us the kind of power supply that will make this country an industrial nation? Why do we not have a public transportation system? Our railroads were created very many years ago, and they worked very well. But and then a system came and collapsed it.
And then we set up a new capital less than 40 years ago. And then we decided not to put modern light rail, modern transportation system. Whereas these things have existed for nearly 100 years.
Thank you, sir.
In Europe.
Thank you. So we are now calling attention of government to really examine the possibility of bioterrorism with COVID-19.
Bioterrorism.
This is what I would want to call attention of government to.
Because we are vulnerable.
To begin to put in place a framework, for responding to such possibilities.
So it means that government needs to put together a committee of experts to study the security dimension of COVID-19.
Exactly. Because you see, this is war that no army would fight anymore. This is a war that no guns will be used. Yes.
You don't see the enemy.
Yes. Is it possible that post-COVID-19, Africans, and indeed Nigerians like you and I, would now be told by the international
what to do
community, you can't come into our country until you have taken our
vaccines?
And these are the means by which they inflict infertility on populations, on target populations. Right now, it is known that in Western countries, there are places where, and in fact, in the East also, in Asia, the developed countries of Asia, where they deliberately produce chemical agents that they inject people with to make them mentally deficient.
Wow.
So, and if you recall, sir, that there have been times in the past 3-4 years that leaders of Africa have been called out, either to the West or to the East, to go and discuss their own developmental issues. So there is a new scramble for Africa.
There is definitely.
Yes.
And this may be, we may actually be seeing a dimension of the war between between China and the US over territories in the poor countries.
So that's one. The other issue has to do with the capacity of the local population to produce food production, for instance, food security. Now, if this is bioterrorism, then it means that the lockdown, which appears to be a global response,
yes,
all right, is just a facade. Because the perpetrators of this bioterrorism are experimenting. How much time is effective to lock down these people
before these people
so that they don't produce?
So that because if these people are locked down, they can't produce.
Yes.
So they will need us to sell things to them.
Yeah, we'll be vulnerable. We will readily accept their largesse. Right now, we're getting supplies, medical supplies from different countries to check COVID.
Yes, if we cannot produce the reagents, we cannot produce the masks, we cannot produce the PPEs and so on, can't we at least have the capacity to test whatever they bring?
No, we have the capacity to do all this. But is there the political will to empower those who can do it to do it?
Yeah, because we have labs in this country. We have pharmaceutical companies that produce drugs that say they are capable of doing these things. They should also be able to test the things that are brought in to see what are the chemical compounds.
So we need a framework. We need a framework, and the earlier we started mobilizing for it, the better for us. Now, I have watched with very keen interest a few developments since the presidential proclamation. About 2 or 3 times now, we've had some massive movement of foreigners, organized lift-up of foreigners.
Yes, we are told that 770 something, people from which country were lifted in the last few days?
Yes, Israel. I think Israel was the last.
Britain did.
No, EU was the last. Now, what that tells me is that
they are preparing for something.
Thank you very much. That's the way I see it.
Yeah, because we are safer. You have thousands of people. We have thousands of people dying in Italy. We have only 2 people dying here. And then if you are evacuating from where people are not dying to where people are dying, it means there's something you know that we do not know.
Thank you. Thank you. So we implore our leaders to take a more critical look at this developments and to begin to create security safeguards, for the benefit of all.
What you are saying, Prof, is that whereas a lot of the conspiracy theories flying about, we cannot
verify them.
We cannot verify them. We cannot take them as true, and so on and so forth. But since there is no smoke without fire, the government should set up a framework to investigate some of these things.
Yeah.
So that our policy positions will be based on facts and figures.
Yeah.
and not just sit down there and whatever is decided in China, in the US, whatever is decided at the EU, the UN level, we just implement and have no indigenous framework for ourselves.
Yeah. And our health systems are also subordinated to them because they are donor countries, yes. International donor agencies who are neck deep in the various conspiracies that have been organized against Africa.
Yeah.
There is no doubt about it.
When we think of what happened with the various experimentations, and not long ago there was the story in Kano, right?
Yes.
Yes. So a lot of experiments have been done in Africa using Africans that are not for our good.
Exactly.
So it means we cannot just take a lot of these gifts and the grants and so on to help us with COVID-19, especially gifts that come in material form, like drugs.
Absolutely. Even masks.
Even masks. Yeah. We cannot.
Now we have ventilators.
Yes.
How are they calibrated?
Yes.
What is their safety?
Yes.
What is their safety capacity? What is their safety value? We really do not know.
Yeah.
Are these things current productions, or are they things that are there to be disposed of, and we have to take them. There are times that the media reported several times that certain medications that were donated even by some first ladies here in Nigeria to hospitals through donor agencies were expired drugs.
Can you imagine?
And so hospitals just took them and kept them aside and said thank you.
Or either expired drugs or drugs that have been banned in other territories.
Thank you very much. Now, we also need to look at environmental safety. In a previous discussion, we talked about a degraded environment, dirty environments, heaps of refuse and all over the place. Now, we are managing COVID-19 pandemic without
looking
into environmental hygiene issues.
Yes.
It can't be effective.
No, it can't be.
It can't be effective.
So whatever approaches for health and for safety against COVID-19 in other countries, we have to contextualize it.
We have to contextualize it. We have to contextualize it.
And so the investment, the monetary investment in tackling COVID-19 should include, you are saying, cleaning up environment.
Thank you. And our government can handle that.
Yes.
Our government can handle that.
I mean, what are the local government staff doing? We cannot just say, okay, whatever is happening in Sweden to protect themselves against COVID-19 is what we will implement here. No. The environment is completely different.
So these are the challenges before us. And I would repeat what I had said before, that we have an instrument in the National Orientation Agency. This outfit of government was very effective many years ago.
During the Mamsa time.
Yes, it was very, very effective.
Actually at that time, they did not have all the infrastructures in every local government.
No, they didn't.
Today, you not only have them in 36 states, you have them in 774 local governments. So all you needed to do as COVID-19 came is to mandate them and empower them to do what must be done.
Exactly.
Go to almost door to door.
Thank you. And it must be a multi-sectoral approach. It must be.
Yes.
There must be an interministerial arrangement to ensure that we give this COVID-19 pandemic a holistic attention.
And wherever it is coming from, whatever the conspiracy theories, we can fight this scourge using the resources that we have. Including the fact that we are religious people.
Yes. Yes.
And even though for safety we are not gathering as churches and mosques, we can still use religious leaders to reach their people with convincing arguments.
And they are effective.
And they are
effective.
Because you see, I see that all the approaches that have been taken since completely discontinent religious people. Maybe because when you think of religious people, we're just talking of gathering of churches and mosques. But there's so much more we can do than just gather in churches and mosques.
True. And in addition, I want our traditional rulers to please come down to our level.
Yeah.
Because at this time, we need them.
Yes.
Not in their gaps, but in their physical presence to mobilize people, you know, and to guide us aright.
Yes.
They can advocate for us, or they can support our advocacy for the things that we need there in order to live.
Thank you. At this, on this note, we'll bring the discussion to an end. I've been speaking with Professor Andrew Zamani, clinical psychologist and former president of Nigerian Psychological Association, on the various dimensions, particularly also the political and security dimension of the COVID-19 pandemic. It's wonderful having you in the studio.
Thank you.
I tell all our viewers, please keep safe. Stay 1-2 meters away from people and keep safe. And then when you need to cough, put your nose, your mouth by your elbow. If you must cough, and do not touch your face. I think in the course of this program, I have not touched my face. Right?
You tried.
I tried. I tried. You
I didn't too.
You didn't. So thank you very much, and God bless you.
Thank you.
Thank you.
Again.
Thank you. Yeah.